And as another reminder, we are going to record this session to share with others who aren't able to attend or participate. And next, we will share the screen. Tom, is everyone able to see the slideshow?
I think so.
Great.
Good. Well, welcome to all of our ACCU presidents and your vice presidential colleagues. We have a large and diverse cross-section of our member schools represented as we gather for the second in a series of 3 webinars. These webinars are made possible through partnerships with respected organizations, and today, like last Monday, we benefit from the cooperative spirit of Susan Wheeler Johnston, president of NACUBO, and our own president, Father Dennis Holtschneider. Special thanks to Jim Hundrieser of NACUBO, who reached out to us at ACCU and then worked closely with us to customize these first 2 programs and also host the technology platform. Jim will again make about a 15 to 20 minute presentation, and then 2 of our ACCU presidents will address a series of topics much on the minds of our members. Thanks to the many of you who submitted questions and topics that you'd like to see discussed, we will focus on 3 broad topics this afternoon: key adjustments to help prepare for the coming year, health and safety scenario planning, and related decision-making and presidential leadership. I'd also like to thank the many presidents who provided feedback on our first webinar. Based on your enthusiastic response, we have kept the same format, but as you know, we have added an overtime period of 15 minutes to field questions that some of you submitted when you registered the end of last week, or that may occur to you during Jim's presentation and the discussion. And as Jim mentioned, ACCU will also make recordings of these webinars available. So please, as Jim said, keep yourself on mute so we don't hear children's, pets, or other background music. And let me just give some brief introductions for our 3 panelists, and then we'll be off and running. Jack DeGioia is a Georgetown alumnus who served as a senior administrator and as a philosophy faculty member at his alma mater before becoming president in 2001. He is dedicated to deepening Georgetown's tradition of academic excellence, its commitment to Catholic Jesuit identity, its engagement with the Washington, D.C. community, and its global mission. Jack is a national leader for us in higher education, having been board chair for the American Council on Education and currently serving as chair of the Division I Committee on Academics, and is a member of several boards, including for the Carnegie Corporation and both the NCAA Board of Governors and its Division I schools. Ann McElhaney Johnson, as president of Mount St. Mary's, leads the only women's university in Los Angeles and also one of the most diverse in the country. She is recognized as a thought leader for the advancement of women, and as president has made gender equity, inclusive excellence, and wellness primary areas of focus. A Holy Cross alumna, she earned graduate degrees in French, undergraduate and graduate degrees in French from Middlebury College and the University of Wisconsin. And Ann has just completed very valuable service as an ACCU board member. Jim Hundrieser is the inaugural vice president for consulting services with NACUBO. His team works to create practical solutions to complex problems. Jim has over 30 years in higher education, including leadership roles at the Association of Governing Boards, at Plymouth State and Lynn Universities, and Marymount Manhattan College. And Jim, let me turn things to you for your presentation.
Great. Thanks, Tom, and thanks everyone for the opportunity to be here. Delighted to spend a few minutes with you and hopefully provide some thoughts as you think about what's next for you. And so for those of you who participated last week, you saw this similar slide with a couple of modifications as we shift our thinking now to how do folks continue to think about remaining open. And certainly we know as you're starting to think about the future, what are the places that you're thinking about? The first is, I think for some of us, we'd hope cases maybe would be gone, but we know that that is certainly not going to be the case. So as we think about August and what's to come, we know there'll be isolated cases. How are you preparing for those isolated cases? Our activities will remain, but we'll be stressed throughout certainly the fall and into potentially the spring semester. Or what happens if the virus begins to resurge? We have a manageable outbreak that will be occurring. And I think for many of us, this is where we're really beginning to decide to focus our efforts, given what we're seeing across the country as new outbreaks are beginning to emerge in the South and West. What will that mean for us? What will that reduction mean? Will students decide to leave? Will we be prepared for that? And potentially, what does that then mean for our start for the academic spring term? We've been talking an awful lot about the fall, but what about the spring? And how will we begin to prepare for that and model for that? And of course, the worst case scenario is now that everyone returns back to home and that it is a distance process again. What about our laboratories and our other equipment? So I think we all hope that that won't be the case, but it certainly is something that we think is a possibility. And as we prepared for this, we've heard from folks asking, what are others saying? And as we've looked at some of the data, ACE recently produced a report, Inside Higher Ed did. The Chronicle seems to have 3 or 4 things a day, giving us some pieces of data. So in trying to compile some of those things together, it certainly said most of us were we believe will be opening in the fall. And everyone said, yes, there will be housing, but the variety of responses that you all gave was significant. Interestingly, though, many in reflection said, well, we want to have an answer. The response is going to be 75% of us. What the governor says is really going to be the influencer of how we decide to act and move. We will have some in-person instruction, but it is going to be more hybrid. I learned today of a school that sent out a 6-day-a-week class schedule that they're moving to engage their students throughout the whole 6 days of the week. 46% talking about masks and temperature checks, many beginning to cancel their study abroad trips, and of course, many of you are concerned about revenue. But as we look really at the calendar, we are starting to hear about more athletes moving back to campus now. So you're beginning to start the process of bringing more students back to campus that you had in the past. Many are talking about starting the academic year early. August 17th seems to be the buzz date to get started. Although last week, since our last webinar and connecting with some of you have said, we just can't pull it off that quickly. So now we are looking at maybe a week later, trying to think about how to start even a few days earlier. It does sound overwhelmingly as if classes are being held on Labor Day, no fall break, and almost everybody going home by the Thanksgiving break. We did begin to hear more talk about mini-mesters or J-terms, so maybe something in the December term if you'll be completely done by Thanksgiving, or what will you do in January if you are thinking about moving the start of the semester back for the spring term. So lots happening, but ultimately we know these outbreaks will continue to be one of our challenges. And so knowing that we are still in a state of influx, I share with you what Jack described to us, hybrid and flexible. How do we think about this hybrid and flexible concept as we're moving forward? How will we have both online and in-person activities? And when you think of all the things that we're doing, I have certainly heard and listened to many more of you talking about the counseling, the student support, and the coaching. And that's both athletic coaching, but others. And then hearing about new ways in which you're trying to consider campus ministry services or health services. And I think following the health advice of many of our doctors is if you're healthy and it's a wellness-like concept that needs to go to your medical provider on campus, can those happen from a telemed perspective versus those who are really sick? Or online IT infrastructure that you need to be putting into place now to ensure that that is rich and robust for students? Or how are you thinking about those contactless transactions? A bookstore is one that comes to mind. I'm hearing about curbside pickup. I'm hearing about things being shipped to residence halls, things that we wouldn't normally have done in advance that we're now trying to think through. And I would encourage you, Tom mentioned my background in student affairs and how do we use our students? Having worked on campuses, I have found some great student help desks who can be mightily ready. We know our students are looking for to be a part of the solution. How might we better engage them in helping provide some of the help desk support we need to be ready for our operations? And as you're thinking about those overall operations, what are the training elements you're putting into place for your grounds and housekeeping crews? How are you thinking about those opening activities? I am hearing this opening activities being a massive struggle. I have heard now about 5 or 6 campuses that are bringing back students a week early in the notion to social distance them. And to be honest, I I don't know that students are really going to follow along in that vein of saying, oh, I go to this session, then I social distance, I go to this. When they're living in the residence halls and such, I think that's going to be a hard challenge for many of you. But I get it, because you want them to have that type of experience. But what are the operational pieces you're putting into place? How are you thinking much more about that flexible classroom? What is the flexible delivery? And more so, I think we've heard in the last 2 weeks, what about at-risk faculty or high-risk faculty? How are you preparing for them? Some of them are reporting wanting to be engaged in the classroom face-to-face. Others are saying, I am concerned about my own health, and how do I do that? So this is how are you surveying faculty now to ask them, based off of what you know today, assumptions that you're going to be open, how will you do that? And might there be a very different role for your graduate students and what they might play, or the research areas that they might be conducting? In particular, I think we're really struggling with the notions around residence halls, how many students per room, what's move-in going to look like, will there be programming overall? I'm hearing less and less programming occurring, or plans for programming to occur. I'm hearing a lot of concerns about the cost that it's going to be to ensure bathrooms are cleaner. And so I think there's that to think about. And as Catholic institutions, if not all of you, 99% of you had strong visitation policies at some point in your history about different genders visiting other students. And so I do wonder, is it time for us to revisit those visitation policies as we think about distancing, and how will we limit that? Is there visitation to be had? Are there policies we're going to need to put into place around visitation because we've had an outbreak in a building? And what type of local hotel arrangements are you creating? So let's say a floor needs to be in isolation. What about the other 4 floors? Do they need to be moved out of the building? How would that occur? Where would you put them? So I think it's now starting to think through, from an operational perspective, how are our housekeeping and grounds crew ready? How are classes able to go into a hybrid or flexible mode pretty quickly? Who are backup people who can teach some of those courses should someone like a faculty member get sick midway? And how will they be living on campus? And while we have no expectation that the federal government will reimburse us for our expenses, we don't know that they're not either. So I would encourage you, we are encouraging NACUBO, you to keep track of all these costs that you're incurring, so that you can hopefully collect those should something occur. I've mentioned a few things on the infrastructure, but as you're thinking about the learning objectives for your courses, how are you really talking with faculty, and where are your program chairs in working through with your faculty to think about that ability to go back and forth? So maybe we can be in person for 4 weeks. Maybe that faculty member is ill, or that there's been an outbreak in a class. That class now needs to be distanced. How will they go back and forth? If you're not familiar with Lab in a Box, that's a tool that the University of Arizona State came up with, but it is actually provided by a third-party provider that allows all first and second year classes, for the most part in the sciences, to be able to do their lab work right from their home, or right from their residence hall room, should you have to go to that. That might be a good option to lessen the amount of contact time that you have, or transition some students into a lab or a work from home concept. The other thing I heard quite a bit about that I'm not sure the government will be as flexible about, or the accreditors will be as flexible about, is practical internships and supervision. What are your protocols going to be for those face-to-face moments? What about if we have another surge that comes October 20th and students are unable to complete their requirements for their course degrees? How are we going to work through that to be sure that we're ready and able to help? On the campus life side, a few things to think about that I am learning more about is 2 types of infirmaries. What about for those who are testing positive with COVID and are very ill? What about those who just have colds, flus, other things that go on that require some type of visit to a doctor and need to do that? What's your partnership with your local healthcare agency? What about students who don't have health insurance anymore? We have moved away from that. Now we're moving back to some states. We're hearing more about students who don't have health insurance, and how are you engaging in the contact tracing concepts and protocols that are required to be in place? If you haven't begun to think about daily briefings as you go back to campus, how are you going to do that? What will happen when that occurs? I think it's time for us to go back to the old school on-call calendars. I remember many of us being on call and Monday was your day and Thursday was your next day. I do think if we continue at the pace that many of you have been going at, we will have exhausted our staff before the students even get back. So how are we mindful of that? And something else is, what happens if there's a significant outbreak on your campus? Some students are able to go home, others aren't. Then what do you do? And so how are you preparing for the notion? In spring, we sent everybody home. What happens if nobody can go home because the outbreaks happened on your campus and you're told they can't leave instead? How will you prepare for that? And I think that will be one of our next new hot topics as things move forward. On the student life side, how are you thinking about using your student leaders to really help you? I have heard about some really extraordinary student engagement experiences. And I've also heard on the flip side, particularly those who have off-campus housing, off-campus organizations, our Greek life, for the good they give, sometimes there's some challenges in that they believe community must happen in a face-to-face environment. So how are we really working with our Greek life and our student government leaders now to be thinking about ways to maintain social distancing and set some pretty aggressive norms and behaviors? And how are you beginning to communicate that out? I think that's really critical that you're starting to engage. If we're looking at the behaviors that are occurring across the country, people want to be outside, and certainly at the start of the school year, they're going to be outside in that spring semester or that fall activities when they want to be out. And we've been hearing about some really neat intramural sport activities. I've been hearing about tournaments that have been happening online that have been highly engaging, high impact. So this is all that virtual activity that I don't understand, but we know our students love. And so how can you think about intramural sport as a way to engage students in ways that have no contact whatsoever, but are building community and engaging students in a variety of ways? Campus ministry as well. How might you be thinking about hosting retreats or other opportunities in small groups or small discussions as you move forward? We talked quite a bit about athletics, and we'll talk about it again. But what's of concern to me is the amount of cost that is coming forward with testing and the other pieces that you might be required to do. Having games, no ticket sales. What is the impact of that, and how will you mitigate for that? So there's all kinds of issues there, I think, on the athletics and its related cost to keeping students safe or to continue to maintain your testing. And lastly, on your commuters in your local community, how are you thinking about how to engage students? So I think about being on the campus and being with a very close town-gown relationship. And what happens if all the town folks decide that they're going to close and those businesses will be closed? What's going to happen then when students don't have the ability to have any food or other social interactions? What will our commuter students do who don't have meal plans? How will they be able to navigate that? And certainly grocery stores and pizza places will often be open, but if your college town was anything like some of mine, students really were heavy participants in that local community. How are you working with those store and restaurant owners to be creating healthy practices? Next, thinking about your mission and all that we're seeing in the world, and how are you thinking about, how are you preparing for the social justice activities that we are almost positive we are going to see? I think as we've gone into now the fourth weekend in a row of rallies, protests, speaking opportunities, et cetera, I think once we get students back on campus, I think they're going to continue to want to do that. And your institutions are known for doing this great work. So rather than hoping it's not going to happen, my advice to you is, how are you really engaging students and others into how are you going to create these social norm, at least mask wearing opportunities? What might be the technology you can provide that local communities aren't providing for free speech opportunities or other things that you might do? And also, how are you thinking about the election? So this may be a very important election for a lot of reasons. And so what is going to happen when you people want to come to your campus? What's the process for that? What's your, on many of your campuses, the Democrats or Republican clubs need to host those people. How are you working with that? How are those engaging on your campus for events? But what about voter registration and electronic or mail-in voting? And if students go home, who's going to be responsible for making sure that student mailboxes get cleaned out and forwarded? Those are often campus activities that you do on your own campus. How will you engage in those as you think about moving forward? And last, I would leave you with communication, communication, communication. You just cannot communicate enough. And how are you thinking through the talking points for each of your different constituency groups? Certainly as a cabinet and extended cabinet, you are probably well aware, but I am hearing about important town halls and other ways where a lot of community members are coming together to ask a lot of questions. I'm hearing about large-scale phone-in nights for students, prospective students who are hoping to come in the fall to ask. I would certainly say don't forget about your parents. They are important, but also, again, how are you engaging in a communication plan for your local community? Is there a listserv they can sign up to, an email list that they can sign up to, things that you would be communicating internally that you might want to be sharing externally? Your website is certainly one of those places, but what about other places where they might be? How often do you plan to communicate? What is your frequency? How are you communicating that out often? And what are those common talking points you need to have? And what are your protocols in place? You are likely going to need to pivot in a way that we probably have never seen before. How are you being honest to say that you don't know what the answers are? I'm hearing many presidents saying these are extraordinary times, and I think, well, that's really code for you don't know. And I get it, and I think this is a time for humility and opportunity to say, we are trying with this strategy and hoping for the best as we move forward. Again, I think as you think about your own schedule, can you really be on call 7 days a week for the next 16, 18 weeks? Is that really realistic? If not, who is your backup? If not, who is their backup? What happens if you get sick? Or what happens if your backup gets sick? What are the strategies you've got into place? So I think there needs to be a lot of time over these next 4 to 6 weeks thinking about redundant systems and staffings that we need to put in place. So a few thoughts as you're thinking about and things you may have already thought about as you move forward. So Tom, I'll turn this over to you and welcome our other speakers. And let me find Jack. Jack, if you can press your button.
Jack is just.
I just wanted you to know I'm here. I was unable to connect by video, so I just want you to know that I did hear most of your presentation, and I'm happy to be here. And I hope I can contribute using my phone.
Awesome.
So reopening is obviously top of mind for pundits and politicians, but as Ann and Jack and I discussed last week, this term is something of a misnomer, since ACCU and other schools have been educating students throughout the pandemic. And as our presidents know best, there has been much important, challenging work going on 24/7. We know that there'll be decisions about the coming year that are beyond our control and will be influenced by state and local conditions. So Ann and Jack, you lead two universities with very different student populations. Could you share the assumptions that are guiding your overall approach to the coming year? Ann, why don't you go first?
Sure. Thanks so much, Tom. Yeah, so Mount St. Mary's University, we're here in Los Angeles, and we are largely a regional university. So most of our students come from the West Coast and many from our own county. As a women's university, we have about 3,000 students, but also that includes a coeducational graduate program and adult degree program. But what we're finding is, as we think about this, there are many different students who are at our university, some traditional undergraduate women in our women's college, and then some returning adult students with many challenges, including work and children home from school and all those things. So we've been really thinking about how do we best meet the needs of the students at this time? And that's really been our guiding question. Now, that becomes an interesting question because we have a lot of students across age groups, a lot of students living in multi-generational homes. And so for many students, actually, there is a fear about coming back to campus. And so we're really thinking about how do we make sure we enable them to continue progress in their academic program through remote learning. We have lots of students like everyone here who are dying to get back to campus. They both for the social interaction, being with their friends, but also because the experience that they chose, particularly in the traditional population for us, our women's college, is to be in a community of scholars where many of them live on campus. If they are commuters, they still spend a lot of time on campus, interacting formally and informally with faculty and staff. And that's such an important part of the educational experience. And so we really thought a lot about how do we assist them as well. I should add that another piece of our student population, we're about 54% first-generation college students, and our student body is over 60% Pell eligible. So we have a lot of students who come to us with financial challenges. And what we're finding is the remote learning has proven quite difficult for many of our students in terms of having a continued and successful access to the internet, space at home to do their work. With all families having been at home, some of our students are in spaces where it's hard to get the kitchen table to yourself. And so, I taught a spring course, and when I was with students and seeing them trying to do their course and being in their Zoom meeting was really challenging to many of our students. And so many of them, had to come and go or opted out of any kind of video or just couldn't keep up. And so that access to the appropriate Wi-Fi, the appropriate remote learning techniques that they have to be successful really started to guide us as well. Our students, for many of them, being on campus, it is the only way for them to be able to complete their academic program, whether the courses are online, quite honestly, or whether they're here. So we'll be offering the blend that I think everyone here now has sort of fallen to, where we'll have some face-to-face, some hybrid, where there's meeting with faculty in smaller groups and then doing much of the work online, and then also online. And our students, all of them, will be doing some remote courses, even if they're in the residence halls. So we're really trying to figure out how do we meet the needs of our particular student body, as diverse as it is, and coming back to campus is one of the ways we think we can keep them engaged and enrolled working on their degrees.
Jack, you have a very different university, one of the most complex universities in ACCU. So what are some of the guiding assumptions that are helping you as you think about the fall?
Thanks very much, Tom, and thank you, Ann. I'll build upon some of your reflections. I think we've been very explicit. I've shared our what we would describe as our practical assumptions with our whole university community as we've been trying to prepare for the reopening this fall. And let me just go through them. Some of them will be, I think, very familiar, and all of you would no doubt be sharing, and a few may be more specific to the circumstances for our community. It's important, as Thomas just shared, we're about 17,000 students on 3 different locations here in the city of Washington. I'd say easily 2/3 of them would be on one location in the neighborhood of Georgetown. What is, I think, significant about that is it's a very residential undergraduate student body. Virtually all of our students, they're required to live 3 years on campus, and about another third of the remaining will be right on campus, and the rest will be right in the immediate neighborhood. So it's a very densely residential framework that we operate in. Our first state for students would be California, so it's a truly national student body. Like all of you, our first priority is the health and safety of our community, and we're guided by the data, evidence, and expertise of our scientific and public health communities. And it is an assumption that it's in the interest of our academic mission to welcome as many students as is safely possible back for in-person instruction. We do so with an assumption that there will not be significant advances and a safe and effective vaccine becoming available by the end of this year. So everything that we do takes into account the need for what I know all of us are engaged in right now, which is developing sort of a layered public health framework that includes, regular self-screening for symptoms and physical distancing and face coverings and testing and tracing and isolation, quarantine for those who might have been near somebody who tested positive. While no framework is going to be able to eliminate all the risk, we recognize that a layered approach is going to be integral to our efforts to mitigate risk. We know we have to have as an assumption that we'll have the active participation of members of our community in sustaining this public health framework. And as Ann just described, we too are going to use sort of a hybrid and flexible approach, because we recognize that if a student's either tested positive or has been near someone who's tested positive, and so they have to be isolated or quarantined, we're going to need to anticipate absence from class. So all of our classes will have to be capable of being captured, whether they are fully virtual when they're being offered, or whether we have in-person class that we are recording so that we can share it with students who might not be able to be present. Will be a piece of what we do, but we're not certain what our model is going to be for all of our university for the fall. Right now, we're looking to bring all of our law students back. We'll do so in a way that reflects that layered public health framework. Very few of our law students, as a percentage, are residential. They live in the larger Washington, D.C. community, and we're going to try to approach that in a way that's distinctive to our law students. Our first step in reopening is unfolding now as we reopen some of our laboratories. And so we're going to begin with a pilot with our research community. They said we'll launch the law school as a fully present program, but it will also have that hybrid dimension of virtual for those who are either uncomfortable coming to teach or those who are uncomfortable coming to campus. We recognize that we have differentiation across our academic programs. The most significant challenge we face is how many undergraduates we can safely bring back to our residential community. And that's the puzzle we're still wrestling with, and we've got a few different models we're approaching, but that may come up in future questions in our conversation today.
Thank you, Jack. So let's look, both of you talked a little bit about academic life, and Jim talked about the academic calendar. Maybe talk a little bit about how you're anticipating making adjustments for residential and campus life. And what's going to be different about the way you do residence life and campus life, and what are some of the things that you're going to try to do as usual?
Right. Well, first of all, I think we have to all anticipate that this year, and possibly even going into the next year, but this year is just going to be different. I don't think there's going to be anything as usual because, as Jack was saying, all of us are looking at, we need to do social distancing on campus, whether, it's in a classroom or whether it's in just around our campus with our dining halls, in our chapel. And we'll all be with face masks. All will have coverings on their face, which changes the dynamic as well, although I think we're getting more used to that. Right now, when we were doing a prep call, we kind of laughed and said that this is a snapshot in time. This is what we're thinking today. But I'm sure you, like we have here in the city of Los Angeles, in our county of Los Angeles, in the state of California, we have 3 levels of government that are also making lots of decisions and recommendations and mandates as is appropriate. So we're working with a lot of different not just recommendations, but compliance issues that will really guide us and I think will better ensure the safety as much as we can for all the members of our community. But in terms of residents, we are, like I think most institutions here on the call probably, we are opening our residence halls, and we do that for a number of reasons. One, obviously, our students are dying to get back, and many of them really need and crave that space to be able to do their work and take care of their needs. And we have students who have said, it's very hard for them to even access some of our support systems on campus, whether it be academic support when they're at home and their families around, or whether it be our counseling services. That's really difficult for students, even though we had good telehealth counseling services throughout the spring. It's really hard to take advantage of those if you're in a home without a lot of privacy. So we believe it's really going to be helpful for our students to be back on campus, but it's only going to be, we're assuming at about 50% capacity in our residence halls. So we're now looking beyond, and like many people, we are looking at possible master lease with apartments. We're looking at housing, and we have a local university where the residence halls are no longer used, so we're looking at some of that perhaps. So and we've also been talking to some hotels about how might we procure space. So all of those pieces come together, but it gets really complicated because then you are talking about having a residence hall life in very different facilities that are also away from campus, and you're needing to staff those. So that becomes another an interesting question. And when Jim was talking about, how are we going to all sort of sustain this level of engagement, and that's going to be challenging. In terms of all the other ways of doing campus life, we have a great team that's working on that. I think the spring was a good testing ground for us. I think we got better at it. I know we got better at it. We know where things were lagging. We know what students responded to and what they didn't. And so we're really working closely now with students as well. Our Student Government Association is working this summer, really thinking about how can they be engaging students, and how can we be rethinking our different traditions and our different activities and our clubs and orgs to interact in a more virtual manner. Because, I mean, the fact will be for all of us on campuses, we're not going to be gathering in large groups. And so, and we're not going to be having the same kinds of events. So we really have to think, what will we do this year that will feel very much part of the culture of each of our institutions? For us, what will be very Mount-like, and how we create that interaction, that intimacy that is a really important part of our community, through virtual gatherings, and then gatherings that are just going to look really different, and they're going to feel different. And I think we just have to keep talking about, yeah, this is different, and not try to mimic what happens in a more regular year when you can have hundreds of students together and hanging outside and being very close to each other without any kind of barriers.
Jack, Ann alluded to something that we talked about last week, and maybe you'd be a good person to give people some advice on this. I remember you said last week how important it was, you thought right now, that the presidents are interacting with city officials, county officials, state officials. Could you say a little bit about that work and how you see that as important over the next couple of months?
Sure, Tom. And I don't think Ann could have described the challenges and the dynamics that we're wrestling with better. It was just beautiful. I think, like Ann just described, we have to work within a framework that is essentially imposed on all of the universities. Here in Washington, it's called Reopen DC. And actually today is the move from stage 1 to stage 2. In stage 2, the most significant, it's actually a rather significant move. Most significant thing for universities is crowds larger than 10 up to 50 can now form here in the district. We were assuming we would get waivers on class size, even if it stayed at 10, but we can now get up to 50, and lots of different kinds of businesses are able to reopen effective today, including indoor dining and sports clubs and gymnasiums and the like. We still can't reopen yet without the city's approval, but we will be securing that as we work together with the department that has been designated by the mayor for us to be working with. And we've been working very, very collaboratively and closely with the city government to be able to accomplish that. There's an assumption that I didn't make explicit a moment ago when I was going through some of the assumptions. And that assumption, you can use different language to describe it. We'll be prepared for the second surge is one way of describing it. A better way perhaps might be, we'll be prepared to manage outbreaks in our community. And I think that captures an element that's going to be crucial to our ability to work with our local communities. Because I think what will be of most concern, both right here in our neighborhood with our local neighborhood leadership, as well as with the city leadership, is that our testing and tracing and our ability to quarantine and isolate will be sufficient for us to be able to manage any outbreak that might emerge in our community. For us, in terms of our residential community here on campus, what we're most concerned about is its density. And one of the options we've been exploring is, could we go one to a room, and will that enable us to manage density better? We too have been looking at options like local hotels to just give us more capacity to be able to spread out that density a little bit more. But again, we've got to be able to manage that flow of people into the community of Washington and then to our campus. All of our law students will be in the city of Washington going to our law school campus. Our graduate students will be in the city coming to our campus. So we'll have this kind of flow between the municipalities in any of our communities and our campuses. We will not be able to create bubbles on our campuses alone. So how can we be able to reassure those around us that we've got the capacity to manage those outbreaks as they might unfold? You've seen evidence of those outbreaks in a number of settings recently. Again, Tom, we can discuss those if that's helpful.
Yeah, and Jack, maybe one thing we might follow up on, all the ACCU schools have strong community service programs. We have a lot of students out in the community, and many of our schools are hubs of activity for the community. How are you thinking about how you will alter perhaps our students going out into the community for service and other reasons, and any changes in the degree to which we will be welcoming community members onto the campus?
Tom, there's kind of another dimension to the logic, and I'm sure everyone on the call is using similar kinds of words to describe this. But to Anne's point a moment ago, she couldn't have captured it better in saying just how this is not going to be like any other fall. We're in a pandemic. We are wrestling, we're wrestling with a lethal virus that spreads asymptomatically. There is so much we don't know. So we are going to approach this in stages. And in our first stage, there are elements, as you just described. Our law students are deeply immersed. Most of our law students have clinical experiences working with legal clinics that take them out into the community. Our nursing students, our medical students, these all have, as part of their academic programs, being in hospital settings, being in community healthcare settings. So as part of this first phase, we want to make sure we're attending to those for whom it's essentially a requirement for their academic continuity and to be able to bring completion to their studies. We're going to start there to see what do we have to do to be able to get that right. And you're quite right. All of our campuses are deeply immersed in the communities around us. And part of it, I haven't gotten into the, what are we thinking about in terms of density on our campus? We're not going to be able to bring everybody back at once. And so we're trying to imagine, given what we're able to do, what is realistic in terms of being able to sustain some of our community outreach. We've been with some community organizations for more than a half century. We expect that all of us are going to have to cope with some changing dynamics over the course of these first few months. We're counting on those deep histories to enable us to be as creative and as imaginative. Maybe some of the work we do in after-school programs and the like, we may need to do virtually, as we tried to sustain some of that during the spring. But it was so disruptive for everybody in mid-March to get to the end of the semester in all of our settings, at K through 12 and even in our own campuses. I think we have to be a little patient with ourselves in terms of what our expectations are to be able to sustain some of our work as we go into this fall.
I guess with both of you, one of the things that I know several presidents have raised is the fact that they're trying to do health and safety scenario planning, obviously alongside the financial scenario planning. I'm wondering, as the two of you are thinking about various scenarios in the fall, what are a couple of the key triggers in those scenarios that you think you'll need to adjust to? And what are some of the key triggers that you're thinking about in terms of scenario planning for health and safety issues?
Well, we're going to start. First of all, I think we are constantly monitoring and seeing changes in recommendations in terms of how to best support the health and safety of the community through testing and tracing. And so right now, we're creating a plan that we also know will probably shift, because if we'd created a month ago, it would have shifted radically to today. So we're creating plans to figure, how can we best, as we bring people back, how can we sort of start a baseline? And we're thinking about that. And then how will we continue to monitor the community to see, are we having an uptick? Are we having cases? Is there an uptick in cases? Is there a particular group of students? So, to Jack's point, as we think about, we have a large nursing program, both at the graduate and undergraduate level. And on our undergraduate nursing programs, we have 4 of them. Are, how will we, knowing those students will be going out into the clinical settings, as we anticipate they will be allowed to, how will we track them in particular, because they are going to be at a greater risk. But we also, we're going to be doing, and I'm not sure, Tom, if this is your exact question, but we'll be doing different protocols to, in terms of using, as others are probably thinking about, an app that, sort of, you have to report your status every day, and you get a pass to, you're cleared to come to campus, to really help people, to really help people start to think about their own health and what they're bringing to campus. And then there'll be a lot of different protocols on campus around distancing and face coverings, and then we'll be doing testing, and that's where we're really debating now. We're looking for a partner. The cost is eye-dropping. Actually, it's really, it's very difficult to think. I've heard of institutions, some in our state, who are going to be doing testing every week of all of their students, faculty, and staff. That's not something we'll be doing. So we'll be monitoring where we do test and figuring out how to do that. I will say, as we're weighing the financial and the safety of our community, the safety wins. But it also means that this is a real challenge, and it's going to be a real stressor financially, quite honestly, that our board is anticipating, we're anticipating. This is, as I said, it's a year like no other. And so we will be doing what we need to do, but it's going to be really challenging. And then we'll continue, we'll monitor and we'll pivot as we need. We are ready, as every faculty member knows, and I am incredibly appreciative of the flexibility and openness of our faculty through this entire situation. But they all are aware that at any moment we go completely to virtual. At any moment, we have a different protocols in the residence halls, not necessarily sending everybody home, but we have a different way of interacting. So as we monitor, we're just going to continue on a daily basis, respond to what's needed now, and also responding to changing guidelines from our state and our local officials here in Los Angeles.
Jack,
I could build, Tom, I could just build a little bit on
yeah,
say
please.
A few more words about testing, if that'd be helpful, because we're still trying to figure it out. As Ann said, the costs are staggering. To be able to do this as frequently as may be required in order to address the pandemic. I keep reminding myself, and I don't know if it's going to be helpful, but it's a once in a century kind of event. So we may have to, I believe the expectations here for Georgetown in our local community and in our city is that we will have a very significant testing program in place. So imagine that everybody comes to campus, everybody returns, whatever the number turns out to be. But let's imagine everybody returns and they're here for a residential experience of some kind. Our faculty and staff are returning at whatever number makes sense. We'll no doubt have significant telework continuing, but let's assume we bring back a group of people. Our expectation is we would have a responsibility to test everybody when they arrive. Now, if somebody arrives and they have no symptoms and the test is negative, we feel pretty good. You come right in and let's go to work. If you arrive, you have no symptoms, but you test positive, we've got to put you in quarantine. And we'll also have to put in quarantine anyone who had significant exposure to you during the time from when you arrived to when you were tested. Now, we'll likely have to test all those people again, roughly within that first week, because the false negatives on testing right now are not insignificant. They could be as high as 25 to 30%. So you may have tested negative, you may have had no symptoms, but you could be carrying the virus, which means you're asymptomatic carrier of the virus. Right now, I was on a call the other day, and one of the speakers was Dr. Fauci, and he's used the number of 25% of all spread is asymptomatic spread. So whether it's pre-symptomatic or asymptomatic, we're going to have to test you again relatively soon to establish the baseline. And then once we have the baseline, like Ann has described, we'll monitor, you on a day-to-day basis. But more than likely, we're going to need to do some random testing, or there's some new techniques that you may have been reading about where we might test wastewater of a specific residence hall. We might test in batches where we might do a group who live together on one floor of a residence hall. And if there are no positive tests, then full speed ahead. But if there is a positive test, then we'd have to do more rigorous testing. The challenge is, thus far, these last 3 weeks have not been great for all of us in terms of the limited and anecdotal, but nevertheless, examples that we could look to. And I know you may want to get to athletics in a moment, Tom, but I would just say that you had the two teams that competed for the national championship in college football just 6 months ago. And in their first, 10 days, more than 50 members of their combined teams, 30 at one school, 20 at another, have tested positive. Now, again, these would be, for the most part, asymptomatic positive tests, but they still have to be quarantined. And they're going to need to be quarantined for 14 days, and they're going to need to make some other choices about other members of the teams. So you can see how complex this testing is going to be, and we're all going to be constrained on the cost. We will not be able to do as much testing as we might need to, just given that cost benefit analysis. We only have so much resources we can dedicate to this and still deliver our overall mission.
Tom, can I just add one thing on that?
Yeah.
And that is, I think also the challenge that we're all facing around the testing is when you have students coming to your campus commuting, they're leaving every day. So we can test on Monday, and Tuesday could be a different story for any student. So we're really thinking, I think we're focusing as well as the testing, but really the protocols on campus around keeping safe, because you just can't keep up with the testing in a way that you have any absolute certitude.
We're going to come back to a couple of specific areas, including athletics in the overtime period. But since we have some people that may be leaving us at 5 o'clock, Jack, let me start with you. As you look back on decision-making the last couple of months, and as you look ahead, how is board governance functioning differently than in the past? And how is shared governance functioning differently than in the past? Maybe say a quick word about board and then about shared governance and how those are operating right now.
Sure. So we have a relatively large board, roughly about 35 to 40, depending on how you count the ex officio members. So think of it as roughly 35 core members of the board. We have an executive committee of about 12. That group has typically met once a month since mid-March. The full board, we convened right as we were breaking in mid-March, and then we convened the full board again for a regular board meeting about 8 weeks later. The executive committee is the group that kind of sustains the continuity with the board. And again, the chairman and I speak quite regularly. We have a subcommittee of that board, of the executive committee, working on issues related to finance. And then roughly about a month ago, we established a special working group of the board that's really focusing on the return to campus. We didn't need as much day-to-day or week-to-week board engagement between mid-March and early June, because we were bringing to closure a semester. And while we were doing lots of planning and sharing that with the executive committee in our monthly calls in April and May, the real work of reopening has began in late May. And there we have a group that we meet with weekly with the board. Some members of that working group are on the executive committee, some are not. And we've been able to sustain pretty strong coherence with the board. Similarly with the faculty, we have a very strong shared governance framework. The president of our faculty senate has been long serving. We had some very tough issues to address early on in April that really regarded our financial framework, looking ahead beyond April, May, and June into the next fiscal year. We're on a July 1 to June 30th fiscal year. And in that context, we really needed to work in that shared governance framework. We have a budget committee of our faculty. The faculty leadership is strong and coherent across our various schools and campuses. And we really needed their engagement as we made some very, very hard financial decisions that positioned us to wrestle with the implications for this coming year. And I think the framework, the alignment we were able to secure with our faculty and with our board has really enabled us to sustain coherence as we go forward.
Good, thanks. And I'm going to turn to you to talk about students. Jim made the comment during his presentation, and it came up last week when we were talking. Have you thought about some ways that you want to engage students in helping the university stay healthy? Yeah. Rather than imposing all sorts of rules, which we have to do, are there some ways that you think you can engage them to sort of take leadership roles? Maybe just say a couple of quick things about that, if you would.
Sure, absolutely. And actually it won't work otherwise. You know, I really believe that the students have to really get invested in this. And so we have a group of students working now with our student affairs professionals to develop a campaign around this. So because we know we're going to have to really do a lot of education before students come back to campus. Here's what it's going to mean. And so the students are coming up with a lot of that so that they can share that with their peers about, you know, here are our responsibilities, and really trying to put in the context of being part of a community. Particularly our students, our traditional students, are all of an age where probably more who would get sick would have symptoms that would not be as serious, but they're also really thinking about our faculty, the staff they interact with. You know, the fact that they could send a student could be asymptomatic and then bring this home. So they're really engaging about how do they help their peers think about, this is a community effort and we students can really help drive it. And that's really where it's got to be.
As we move into overtime, I want to turn to some of the questions that are coming in on the chat line, and also questions that came in the last couple of days. And one of the questions that got asked during the presentation was whether presidents are requiring masks, and if so, in what situations. So maybe Jack, you go first. Are you going to be requiring masks or recommending them, and under what conditions?
Our current thinking, Tom, is we will be requiring masks. We will be requiring social distancing. Here it's, you know, the sort of the standard six feet. We will be limiting the size of gatherings. I wouldn't want to understate the significance of that physical distancing. When we look at what it will take in a typical classroom, we're going to have to shut down all of our seminar rooms. There's no way we can get the physical distancing there. But in even large classrooms, a classroom of 80 will likely hold 20 when we put in place the social and physical distancing. But we will, right now, our current thinking is we will be requiring masks.
Anne, how about you?
Yeah, we are requiring masks, and also I should say that is actually mandated both by our city, and our governor just put that mandate into practice for the state right now. But we absolutely will be, and also practice social distancing, because actually those two things together are your best assurances to protect not necessarily yourself, but the person with whom you're interacting. We really want people to understand that. If you wear a face covering, you're protecting the person you're with, not yourself as much. So that's really an important part of community.
One of the questions that's come up is how you're handling either faculty pushback on returning to person-to-person instruction, and how you're handling faculty members who might have difficult situations health-wise and so are at greater risk. So any pushback that you're seeing from faculty in doing in-person instruction, and then how are you handling the cases in which people have some comorbidities, is such a wonderful word, but have conditions that are going to make them more at risk. Jack, how are you handling that?
Sure, Tom. We would not require anybody with comorbidities who are in a risk category to return. That goes back to that earliest comment I made in this call regarding the need for that virtual character of what we do. If a faculty member is really at risk, we're not going to ask them to return to campus.
Anne, and how are you going to handle that yourself?
We actually went, our provost worked with the faculty and asked every department to look at all their course offerings, talk among the department faculty about how they wanted to do this, what courses could be remote, what courses have to be in person, what could be hybrids. And that really allowed the faculty at the department level to think about who's uncomfortable coming back to campus and how could they as a faculty really distribute those responsibilities in ways that will meet with both the desires, but also in some cases, the physical needs of our faculty. So I have to say, we haven't experienced any pushback, just concern about how we will offer a protected environment as much as we can for those who are coming back and who would like to come back, but it's more concern. But there's been great flexibility that we're building in because we really have to. I mean, as Jack said, you can't force, you shouldn't have someone come back who shouldn't be on campus.
One topic that we did not get to last week that we promised we would get back to this week is athletics. And Jack, you have a perspective as a board member, both of the overall NCAA and Division I. So maybe you could talk from that perspective, not just to your Division I colleagues on the line, but all the presidents. What are a couple of the key issues that you would suggest that presidents be thinking about in terms of intercollegiate athletics?
Well, you're seeing just how complex this challenge is going to be playing out in real time right now, Tom.
Right.
With the return on June 1st of many of the Division I football programs. But I think each school operates in its own context with its own set of plans and local conditions. And that's the basis under which any of our efforts on athletics are going to need to take place. The NCAA has offered two formal pieces of guidance. On May 1, the NCAA released the core principles of resocialization of college sport, and then on the 28th, a further update on it, which was essentially action plan considerations. And what they've essentially done is establish gating criteria in this second document that, essentially, just like in any region of the country, there must be a downward trend in reported illnesses, downward trend in documented cases, sufficient hospital capacity, robust testing. But there really are, such significant uncertainties going forward, and I think it's going to differ by location. Could seasons be delayed? Could they be moved to spring? June 1 was the date that the NCAA set to permit teams to return. And again, the early signs are really showing us just how complex it's going to be to imagine returning to any sense of normalcy with intercollegiate athletics.
One of the things that I did over the last few days, Anne has intramural athletics, and Jack obviously is in the Big East at the Division I level. I surveyed about 10 or 12 presidents who are Division III and NAIA, and a couple from Division II. And just starting with cost issues, the vast majority of ACCU presidents who have instituted cuts in athletic programs or anticipating that, most of those presidents are in Division II conferences, because obviously they have an expense situation that's different from Division III. The Division III presidents, obviously far and away the biggest concern right now are all of the health and safety issues. And actually, two of the presidents said, and I suspect this applies to many of you here, that they are feeling reasonably confident that they will work out the health and safety issues on their own campus, but they're not quite sure that they are quite as trusting about how some of their rival schools will handle the health and safety protocols at the same level. Obviously, a second big concern, particularly for the Division III schools and the NAIA schools, is the enrollment issue. And a couple of presidents were very honest about the fact that one reason that they have to talk about the fact that athletics will happen is that an enormous part of their freshman enrollment is tied to students competing in athletics. And so there's a real worry among some of these presidents that if there's not going to be intercollegiate athletics, some of those students might transfer or decide to take gap years. And then the third concern that several presidents mentioned, and it's very similar to what Ann and Jack have been talking about, is that on the one hand, they see athletics as posing the biggest risk on their campus in terms of health and safety, and yet on the other hand, it's something that they are very much dependent on. In terms of adjustments, several of the presidents are talking about some kind of daily testing, certainly temperature testing with athletes, that will be done every single day. Several of them talked about the fact that they are revising and putting far stricter guidelines in place for athletic training, for strength, for conditioning activities. And one of the things that seems to be emerging, I've now heard this from 6 or 8 different presidents, that while the conferences have not yet made decisions, these presidents have pretty much decided that they will not play non-conference games, and they will not play games that involve significant travel. And the reason for that, of course, is that the physical distancing requirements for football in particular would mean a very, very expensive situation if you have a lot of travel to do. In terms of costs, the costs are fairly predictable ones, but the Division III presidents in particular talked about the fact that they were hearing that there were going to be significant increases in transportation costs because of the need for physical distancing. And I might mention that one of the presidents who's been responding on the chat line about the whole question of masks is saying that he suggests that we use the term physical distancing rather than social distancing to reinforce the fact that we want to keep social connection and that the real issue there is the physical distancing. One of the presidents responding to the sequence of messages about masks, and maybe something, Ann, I'll start with you and then go to Jack. They're considering having masks required at all times in public, but they're asking, have you thought about the enforcement of these policies? Will there be disciplinary consequences? Is this going to apply to faculty and staff? He didn't ask this question, but it's one thing to discipline a student. It's another thing to discipline a tenured faculty member. So how are you thinking about how these things will operate? Ann, why don't you go first?
Sure. So I should say, I have zero patience with people who won't wear a face covering. And so, and I think that will carry over into the year. So I feel very strongly, first of all, we haven't quite figured out how we'll do this, but our students it will be part of their requirements to be on campus as part of their handbook, or whether they're going to sign a social contract. I'm not quite sure. We're still working on those, on the way to do that. But absolutely everyone will have to wear a face covering when they're out in public. Again, for us, it's actually a little easier in that, now this could change, but it is a city law in LA. It's not a county law, but it's a city law, it's a regulation, and now it is statewide, just as of 3 days ago. So, and we are required to provide them, so we will. So we'll be providing face coverings for all of our employees and also for students. And then we'll have some, so if a student forgets her mask to come to class, she will not be allowed in a classroom without it. And so there will be a place she can go to get it. We don't want to make it so easy that no one remembers to ever, bring them, because we won't, there'll be a limit finally to the supply. But we're going to make it part of the culture. We're actually branding our face coverings. So every student will get one with, a version of our logo or something on it, and to try to make them just a little bit less intense. And that's also a consideration. Our faculty were told, if you're teaching on campus, you have to wear a face covering while you're teaching. And so think about that. Think about how that will work for you and with the work you're doing with your students. So yeah, everyone will have to, there'll be spaces if you're in a private office, if you're in an office with cubicles where there's plastic and we're putting a lot of the plexiglass kinds of things, we're redoing, you know, where everything had become much more open, we're compartmentalizing, which is a little bit unsettling to me, but that's what we have to do. So we want to make sure people, while they're at their workplace, employees, that there is some ability to take it off at some point, just because it's really, it can be difficult. I don't know if anyone here has kept a mask on for 5-6 hours. You know, I haven't. It's, you know, after 2 hours, I'm like, I just am dying to take it off my face. So we're trying to figure that out, but it will be absolutely mandated, and we will call out faculty and staff on it because we're going to make it a community standard. It's going to be about caring for each other, and that as part of a community of responsibility for me, and I have responsibility for you. And so it's going to be within the real way we think about, as a Catholic university, we take care of each other, but it will be required.
Jack, I'm going to turn maybe for a final comment on something. You've been a president for 20 years, and so this is not your first rodeo, but it is an unprecedented one. And I'm wondering if you might say a little bit about any new insights you have had into your leadership as a president during these times. Do you find yourself leading differently? What are a couple of the things that are most top of mind as you have led during these last couple of months?
Thanks, Tom. You know, I would say that what I did learn over those years was just how important I think the earlier presentation captured this too. We can't communicate enough, and whatever we're doing, there's more. And I guess one of the things I did right after we had a breakup, I started a sort of series every day for roughly the first 10 weeks that we were kind of at stay at home. I did a roughly 15 to 20 minute interview with a member of our community. Usually it was a faculty member, senior leader, and we posted it on our university webpage and on mine. And just, they could be public health leaders, scientists, community, and folks involved in community service. But we just captured, some folks were just kind of, legendary members of our faculty. And I just tried to stay in contact with members of the community that way, doing that day after day after day. And in addition, we started, like I'm sure most of you, we started live streaming our Mass on Sunday from our chapel here on campus. And I've attended each of those and I've done one of the readings at the Mass. And weekly we get about 10,000 viewers to the virtual Mass. During Easter week services, Holy Week services, we had more than 100,000 folks watch those services online. We've done special events of different kinds, lots of letters when it was appropriate. It really has been trying to kind of be present and be connected. And so, showing myself in the chapel was kind of one way of being present. People recognize the space and the place, and it's been a good way for us to try to keep the place connected.
Thank you, Jack. And I'm going to kick things to you for the last 2 minutes. And Jack started to answer this question as well. I have not talked to a single president who doesn't say that they are working harder than ever, and that the stress level is the most it's ever been. And some of these presidents have been president like Jack for 20 years. So I'm wondering a closing word or two from you as to how you're taking care of yourself. Jack talked about attending Mass at the chapel. What are some of the ways that you're taking care of yourself during these tough times?
This is actually kind of funny, but it's true. I think because so many of the interactions, the social interactions that we have as presidents have been just eliminated. I find that, I'm working a lot, but I also find that I get more sleep than I used to. I choose what I eat now. And I have to say, you know, there's been a really interesting thing that has had a positive impact. I'm not going to dinners and breakfasts and lunches all the time. I actually make my own food again. And so, you know, I'm really trying. I have been very conscious of the need with this stress to really manage my own health, because we are no good to anyone, our families or our communities, our universities, when we are stressed to that point where we're not really effective and we're not really kind and as understanding and patient as this job requires. So I really have been intentional. You know, I have my schedules a little more flexible than it used to be. I don't have 7 o'clock breakfasts. So, you know, I go running, and so I really have put into place some things, quite honestly, that I often felt I never had time for. And I hope I managed to keep those part of my schedule, because that has been enormously helpful. My big worry, quite honestly, is more at the senior team level. I am trying to figure how to help people take time off and to regenerate this summer, in a time when no one really wants to take a summer vacation because there's so much work, but also, where are you going to go? And so, you know, so I do think that's the challenge. And my senior team and I have been talking a lot about that. You know, I keep saying we usually don't meet in July. So do we have to meet weekly? So we're really trying to create some sense of break from each other, break from our responsibilities. Because I think this is going to be an incredibly challenging and difficult year ahead. And I think people are just going to get really sick of all of this. And so I'm really thinking about how do I make sure that everyone is taking care of themselves enough that they can sustain this level of stress, because I don't think the stress is really going to decrease in a significant way. And that's our jobs. So yeah, it's been an interesting mix. And but I have to tell you, I come to this now. In some ways, I have more balance than I have in a long time.
Ian, you managed to return us full circle to something that Jim emphasized twice, I think, during his presentation. And when he was talking about everyone cannot be on duty all the time. And it seems to me that one of the nice things that you ended with is that while important presidents take care of themselves, we have a responsibility to be paying attention, particularly to our senior team, but also leadership around us. Ann and Jack, thank you so much for your generous contributions today. And Jim, as we finish these 2 webinars and look forward to a 3rd one next week on liability issues, thank you so much to you personally, and also to NACUBO for working with Dennis and me and putting these 2 webinars together. So everyone stay safe and healthy, and get some good relaxation in the midst of everything else. Take good care.
Thank you.
Thank you very much.